It is further that all restaurants and dining rooms, as well as banquet facilities, private event facilities, and private reception venues where food is served that operate during the effective dates of this order, shall implement measures which mitigate the exposure and spread of COVID-19 among its patrons and workforce. Such measures shall include the following. Guideline number 1. Screen and evaluate workers who exhibit symptoms of COVID-19. Symptoms of COVID-19 may include a fever over 100.4 degrees Fahrenheit, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. While it is strongly recommended that each restaurant have an infrared thermometer on hand to screen workers, it is not required. Workers may screen themselves for a fever with their own thermometers prior to arriving at work. Guideline number 2. Require workers who exhibit symptoms of COVID-19 to not report to work or to seek medical attention. Per existing U.S. Food and Drug Administration food code requirements, workers who are sick should remain home. If a worker becomes ill or presents symptoms of COVID-19 at work, the operator should identify the worker's condition during a pre-work screening and send the worker home. Restaurants shall create, maintain, and follow established policies regarding when workers who have become ill are permitted to return to work. A worker with known or suspected COVID-19 must follow Centers for Disease Control and Prevention guidelines to self-isolate for at least 10 days after onset of symptoms of COVID-19 and end isolation only after symptoms for COVID-19 have improved and the worker has been fever-free and or free of symptoms of COVID-19 for 3 consecutive days without medication before returning to work. If a worker is diagnosed with COVID-19, it is highly recommended that the person in charge notify the health department as soon as possible. Timely reporting of diagnosed cases will assist with contact tracing measures to help isolate and contain the spread of COVID-19. Guideline number 3. Implement teleworking for all possible workers. Guideline number 4. Implement staggered shifts for all possible workers. Guideline number 5. Hold all meetings and conferences virtually whenever possible. Guideline number 6. Train all workers on the importance and expectation of increased frequency of hand washing, the use of hand sanitizers with at least 60% alcohol, and provide clear instruction to avoid touching hands to face. Food service workers are required to wash their hands according to the Georgia Food Service Rules and Regulations, Chapter 511-6-1-.03, 5. Hand sanitizer, for purposes of Executive Order 06.11.20.01, means any hand antiseptic, hand rub, soap, or agent applied to the hands for the purpose of removing common pathogens. Hand antiseptics and hand sanitizers must meet the criteria for the U.S. Food and Drug Administration's Food Additive Definition of Generally Recognized as Safe, GRAS, if food will be touched after using. Hands should be thoroughly rinsed in clean water prior to handling food after the use of any hand antiseptics or hand sanitizers that do not meet the GRAS requirements. Bare hand contact with ready-to-eat food is prohibited. Guideline number 7. Require all workers to wear face coverings at all times. Workers may also wear face shields in addition to their face coverings. Such face coverings and face shields shall be cleaned or replaced daily. Face coverings and face shields are not the same thing. Face shields are clear plastic barriers that do not contact the face, but are worn as a way to protect the full face from spray aimed at the individual wearing the shield. Face shields do not protect others from contaminated airborne particles expelled from the person wearing the face shield. Face coverings are made of cloth or fabric and must cover the nose and mouth while being worn. Workers will not be allowed to work unless they have a face covering. Instructions for making face coverings can be found on the CDC's website. Here are those guidelines. How to wear cloth face coverings. Cloth face coverings should Fit snugly but comfortably against the side of the face. Be secured with ties or ear loops. Include multiple layers of fabric. Allow for breathing without restriction. Be able to be laundered and machine dried without damage or change to the shape. CDC on homemade cloth face coverings. CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as at the grocery stores and pharmacies, especially in areas of significant community-based transmission. CDC also advises the use of simple cloth face coverings to slow the spread of the virus and help people who may have the virus and do not know it from transmitting it to others. Cloth face coverings fashioned from household items or made at home from common materials at low cost can be used as an additional voluntary public health measure. Cloth face coverings should not be placed on young children under age 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the cloth face covering without assistance. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders as recommended by current CDC guidance. Here are some frequently asked questions. Should cloth face coverings be washed or otherwise cleaned regularly? How regularly? Yes, they should be routinely washed depending on the frequency of use. How does one safely sterilize or clean a cloth face covering? A washing machine should suffice in properly washing a cloth face covering. How does one safely remove a used cloth face covering? Individuals should be careful not to touch their eyes, nose, and mouth when removing their cloth face coverings, and wash their hands immediately after removing. Additional information from the Georgia Department of Health for Guideline Number 7. Third-party delivery drivers should also wear face coverings while in the restaurant and when interacting with any customers at the delivery location.